This is the Coronavirus Morning Report for Wednesday, April 22nd, 2020. I'm Jackson Bird. Autopsies show cases of coronavirus fatalities in California back in early February, which might change the entire timeline of the virus. A new study suggests that hydroxychloroquine treatment might actually make things worse. With clinical trials in humans beginning in Germany, another look at where we are with the vaccine. Where did all the other non-COVID related urgent health cases go? And when the heck are we going to get some data? Any data to hang our hats on. Starting with the number again today, there have now been 800,000 confirmed cases in the United States, with the death toll surpassing 45,000 this morning. And just pause to consider those numbers. And it was only a month ago, in the second week of this podcast, when Brian was fearing that the U.S. might see 10,000 deaths. Globally, there have been more than 2.5 million infections and 175,000 deaths worldwide. Another big study of Veterans Health Administration Medical Center patients has shown that hydroxychloroquine might not be the silver bullet some were looking for. In short, this data shows again not only that hydroxychloroquine might not improve the outcome, but might actually make things worse, quoting the Associated Press. With 368 patients, it's the largest look so far of hydroxychloroquine with or without the antibiotic azithromycin for COVID-19, which has killed more than 171,000 people as of Tuesday. Researchers analyzed medical records of 368 male veterans hospitalized with confirmed coronavirus infection at Veterans Health Administration medical centers who died or were discharged by April 11th. About 28% who were given hydroxychloroquine plus usual care died, versus 11% of those getting routine care alone. About 22% of those getting the drug plus azithromycin died too. But the difference between that group and our usual care was not considered large enough to rule out other factors that could have affected survival. Hydroxychloroquine made no difference in the need for a breathing machine either, end quote. And quoting the Washington Post, rates of death in the groups treated with the drugs were worse than those who did not receive the drugs, the study found. Rates of patients on ventilators were roughly equal, with no benefit demonstrated by the drugs. An association of increased overall mortality was identified in patients treated with hydroxychloroquine alone, wrote the authors, who are affiliated with the University of Georgia, the University of South Carolina, and the VA system in Columbia, South Carolina. These findings highlight the importance of awaiting the results of ongoing prospective, randomized, controlled studies before widespread adoption of these drugs, end quote. More word that Spain, Italy, and other countries in Europe, like Austria, are considering exit strategies for their lockdowns, though they are still some weeks out. Austria, for example, is looking to reopen bars and restaurants only by the middle of next month, and Spain and Italy appear to be moving more cautiously than that. Spain is looking at the second half of May to ease restrictions in a meaningful way. A follow-up on the situation in Singapore. That country reported more than 1,000 new cases for the third day in a row, pushing total infections past 10,000. Again, the cause of the case spike seems to be low-wage foreign workers who make up a fifth of Singapore's total population and who are housed in dormitory conditions. Still, the new case number of 1,016 is down from a new case high of more than 1,400 2 days ago, and the number of new cases has dropped for the last 2 days after this recent surge, so this will bear close scrutiny. Will Singapore be able to get a handle on this flare-up this week, or is this just the beginning of Singapore seeing a caseload more in line with other countries? Germany has approved the first human trials for a vaccine in that country. More on the state of vaccine research in a second. And I do want to note that the serology test from yesterday showing possible antibody and immunity rates in LA County has come in for some of the same criticism that the previous tests in Santa Clara County did. The criticisms are the same, folks questioning the methodology and what are reportedly data and math errors. And it turns out that some of these same scientists were involved in both studies, so worth pointing out that both studies have now come in for criticism for similar reasons. Link to a thread about this in the show notes. But more data that just so tantalizingly hints that perhaps the coronavirus might have been, or could be, more prevalent in society than we currently know. Autopsies performed on 2 people who died in California back in February have shown that they tested positive for coronavirus. Quoting the Washington Post, Tissue samples taken during autopsies of 2 individuals who died at home in Santa Clara County, California, tested positive for the virus, local health officials said in a statement. The victims died on February 6th and February 17th, respectively. Initially, the nation's earliest coronavirus fatality was believed to have occurred on February 29th in Kirkland, Washington, a suburb of Seattle that rapidly became a hotspot. In March, health officials there linked 2 February 26th deaths to COVID-19, the disease caused by the new virus. The Santa Clara County fatalities pushed the earliest coronavirus-related fatality back by weeks, with the new findings potentially altering the timeline of the U.S. outbreak, end quote. And quoting the San Francisco Chronicle, those deaths, 3 weeks before the first fatality was reported in the U.S. and Washington state on February 28th, adds to increasing evidence that the virus was in the country far earlier than once thought. What this means is we had coronavirus circulating in the community much earlier than we had documented and much earlier than we had thought, said Dr. Sarah Cody, Santa Clara County's public health officer. Those deaths probably represent many, many more infections, and so there had to be chains of transmission that go back much earlier. Cody did not provide details about the people who died in February, but said that deaths, quote, tell us we had community transmission, probably significant community transmission, far before we realized it and documented it. From what we understand, neither of the cases had a history of travel, Cody said, so we assume that they were acquired locally. People typically die of COVID-19 about a month after they are infected with the coronavirus, suggesting that the person who died February 6th likely was infected in early January. At that time, the virus had been reported only in China. The U.S. Centers for Disease Control and Prevention had not issued any advisories to Americans about the potential threat. End quote. The United Kingdom will begin human trials of a coronavirus vaccine tomorrow, and scientists at the University of Oxford say there's an 80% chance of producing a successful vaccine. The team is even starting mass production of the vaccine before the trial is complete, planning to get 1 million doses ready by September. Human trials of a vaccine are already underway here in the U.S., with Boston-based Moderna beginning one last month. However, developing a vaccine for COVID-19 could be fraught with difficulties. Quoting from New York Magazine, so many brutal viral diseases have been conquered by vaccination, smallpox, polio, mumps, tetanus, that the technique seems all but infallible. But not all viral diseases are equally amenable to vaccination. Unfortunately, it seems that COVID-19 is on the difficult end of the scale. A closely related virus of the same family, SARS, circulated in Asia from late 2002 to mid-2003 and killed more than 700 people. They really are very similar viruses, both virulent and contagious, says Rachel Roper, a professor of immunology at East Carolina University, who took part in efforts to develop a SARS vaccine. Given the similarities of the diseases, their response to vaccination would likely be close to identical. So it's troubling that when researchers conducted animal testing on prospective SARS vaccines, they ran into difficulty. The 2 versions that they tested both successfully triggered the host animal's immune system to produce antibodies, but neither was very effective at protecting against the illness. People think, oh, if you make antibodies to it, it's going to be protective, says Roper. That's not necessarily true. We were able to induce an immune response, but it wasn't good enough to really protect against the disease, end quote. However, even a vaccine that provides partial protection could be enough to help reopen society more fully. As Roper pointed out in the New York Magazine piece, quote, partially effective vaccines can still prevent serious illness and death. And even though it's not perfect protection, it does protect from hospitalization and death. It gives your immune system the jump, end quote. An incident in China might spell bad news for reopening restaurants. A pre-symptomatic person went to a restaurant in Guangzhou in January and appears to have spread the disease to 9 other people at the restaurant, not by coughing on them, but because the restaurant's air conditioners blew the virus particles around the room. This, according to Chinese researchers in a paper being published this July in Emerging Infectious Diseases, a journal published by the CDC. Fortunately, neither the vast majority of other diners nor the waitstaff got sick, but the incident does point to a concerning possibility. Even if restaurants adhere to keeping 6 feet distance between tables, a feat unto itself in tightly packed urban areas, they may still have to worry about ventilation systems keeping viral particles aloft. Compounding the concern about airflow is the long durations of time people spend sitting down to eat at restaurants, and the fact that people can't eat with masks on. This means people are more likely to inhale viral particles because they're spending more time in one place, but also that more particles may be spread around while people are eating food and chatting away without facial coverings. The good news from the study of the incident in Guangzhou is that all of the people who became infected were sitting at nearby tables, and of those infected, 4 of them were relatives of the first patient, which means they easily could have been infected outside of the restaurant. 2 of those non-family members who were infected, however, according to diagrams from the study, were seated directly next to the restaurant's air conditioner. And because this incident happened earlier on in the timeline of the pandemic, comprehensive contact tracing was able to be conducted that identified the restaurant as the only place all of the infected people may have crossed paths. Nonetheless, quoting the New York Times, "The fact that people farther away remained healthy is a hopeful hint that the coronavirus is primarily transmitted through larger respiratory droplets, which fall out of the air more quickly than smaller droplets known as aerosols, which can float for hours." End quote. While the study of this particular incident does have its limitations, like a lack of simulated experiments, the researchers concluded, quote, "Droplet transmission was prompted by air-conditioned ventilation. The key factor for infection was the direction of the airflow." End quote. And Harvey Feinberg, who leads the Standing Committee on Emerging Infectious Diseases and 21st Century Health Threats at the National Academies of Sciences, Engineering, and Medicine, sees this study as a cautionary tale. He says restaurants should pay attention to the direction of airflow when they arrange tables, in addition to keeping them 6 feet apart, and should also consider installing germicidal ultraviolet lights to destroy floating viral particles. Feinberg also points out that these considerations shouldn't just apply to restaurants, but also workplaces and really anywhere we might congregate indoors. As businesses reopen, they will not look or function the same as they used to, and that's a good thing.
If you're a business of any kind, you need to correspond with your partners, with customers, with your team. Virtual work is one thing, but you still need to deliver physical documents. And if you're a business shipping product to customers, well, virtual can only take you so far. That's why I think in the current business environment, any business needs Stamps.com just to keep operations running. Anything you can do at the post office, you can do with Stamps.com. And yet, you don't actually have to go outside and physically go to the post office. With Stamps.com, you simply use your computer to print any official U.S. postage 24/7 for any letter, any package, any class of mail, anywhere you want to send. Once your mail is ready, just leave it for your mail carrier, schedule a free pickup, or drop it in a mailbox. No human contact required. Plus, you can actually save money. With Stamps.com discounts you can't even get at the post office. 5 cents off of every first-class stamp and up to 40% off USPS shipping rates. And now, Stamps.com even offers UPS services with discount rates up to 62%. Listeners to the show can get a special offer that includes a 4-week trial of Stamps.com plus free postage plus a digital scale without any long-term commitment. Just go to Stamps.com, click on the microphone at the top of the homepage, and type in briefing. That's Stamps.com, enter briefing. Stay safe, my friends. It seems like there's more anxiety in the world now than ever, and many of us can get hooked watching the news to feel more in control, but after a while, real-time updates get overwhelming. That's sort of why we started this show, to give you a quick dose of what you need to know every morning so you can get on with your life. But also, getting personalized support for your well-being can help you get on with your life too. That's why Talkspace pairs you with a licensed therapist based on your preferences. Talkspace has thousands of therapists in over 40 specialties like anxiety, depression, relationships, and more. Talkspace is reliable help for you in this time of worry, but also it's affordable help. 1 month on Talkspace costs about the same as a single in-person therapy session, but with unlimited messaging access and daily engagement. And Talkspace is secure for your peace of mind. Safety and privacy are top priorities at Talkspace. Their platform encrypts and securely stores all client information using the same technology used by the banking industry. We all need to talk through life's challenges, and Talkspace offers the support we deserve securely at a price we can afford. Match with your perfect therapist today and get $100 off your first month with promo code BRIEFING. Sign up at Talkspace.com or download the app. Don't forget to use promo code BRIEFING for $100 off your first month with Talkspace.
Doctors are concerned that people without COVID-19 who need other kinds of emergency medical attention are staying away from the hospital, potentially creating a sub-epidemic of severe illness or even silent mortality. As hospital beds have been converted to care for coronavirus patients, clinicians in the U.S. and around the world have puzzled over where the other patients, for example, the ones with urgent heart issues, had gone. The answer seems to be that they're delaying care. Quoting from the Washington Post, 5 weeks into a nationwide coronavirus lockdown, many doctors say the pandemic has produced a silent sub-epidemic of people who need care at hospitals but dare not come in. They include people with inflamed appendixes, infected gallbladders, bowel obstructions, and, more ominously, chest pains and stroke symptoms, according to these physicians and early research. Some doctors worry that illness and mortality from unaddressed health problems may rival the carnage produced in regions less affected by COVID-19, the disease the virus causes. And some expect they will soon see patients who have dangerously delayed seeking care as ongoing symptoms force them to overcome their fear, end quote. Evert Erickson, the trauma medical director at the Medical University of South Carolina, told the Post that he has seen a lot of, quote, late presentation, where appendicitis patients have tried to manage at home with over-the-counter painkillers and then come in with a severe infection that is harder to treat. Doctors had also been expecting an uptick in heart patients, with the stress caused by the COVID-19 pandemic causing an increase in heart attacks. Coronavirus itself can attack the heart muscle, but those cases, too, haven't materialized. Quoting again from the Washington Post, a report to be published in the Journal of the American College of Cardiology on 9 high-volume cardiac catheterization labs across the country found a 38% drop in patients being treated for a life-threatening event known as a STEMI, the blockage of one of the major arteries that supplies oxygen-rich blood to the heart. The study compared what happened this past March when COVID-19 cases were climbing with treatments delivered from January 1st, 2019 through February 2020, end quote. Stroke patients also appear to be staying away. The University of Miami-Jackson Memorial Comprehensive Stroke Center saw 30% fewer patients in March than in February. Quote, what we would surmise is that more mild to moderate cases are not calling 911 or are afraid to come into the hospitals, Ralph Sacco, chairman of neurology and former president of the American Academy of Neurology, told the Post. Hospitals are trying to get the message out there that they have procedures in place to ensure safety from COVID-19 infection, and that therefore people with emergencies should still call 911 and routine appointments should be continued using telemedicine where possible. As mentioned at the top of the show, the news yesterday of those serology tests in Los Angeles has come in for criticism. But we jumped all over that story yesterday for one simple reason. It was welcome. Even at this late date in our crisis, there is so much that we just simply don't know. And it's getting incredibly frustrating. Brian has been threatening to write a segment about this for about a week now, but frankly, this piece from Felix Salmon and Axios sums it up quite nicely. So quoting extensively here, even though this piece is from a few days ago, quote, the single biggest obstacle to reopening the economy is a lack of visibility. We don't know the scope of the pandemic itself, or its economic fallout, or how its trajectory will change as we embark upon an ad hoc effort to reopen the economy. We don't know how many people the coronavirus has killed, or how many people have had it. The official tally of over 37,000 deaths is too low, because it's based on people who died after testing positive for the coronavirus, but we don't know how low. We don't know how many Americans have lost their jobs because of the coronavirus shutdown. The official tally is 22 million new applications for unemployment benefits, but millions more haven't been able to make it through the application process, or haven't tried. The biggest employers will be able to rehire their legions of workers, but the bigger concern is the businesses that will never be able to reopen. We don't know how many of them there will be. We don't know when we'll have a treatment, whether summer will tame the spread or whether the virus could return in the fall even stronger. We don't know whether we're immune once we've had it or for how long. We don't know whether tech will allow us to trace it or whether Americans would sign up for that even if it does. We don't know when it'll be safe to fly, go to a game, or pack into a school or a church. It's shocking and a bit scary how much we do not know, despite how much we do know. End quote. Yeah, not really much to add to that other than to say that one of the reasons you're hearing people getting increasingly bitter, arguing about where we are with the crisis and where we should go next, is because no one has any solid data to hang their hat on. In a way, you can't blame people. If we had an obvious path forward, it would be easier to win arguments. It would be easier to act with confidence, or at least make educated guesses about what we need to be doing. Now, all I'm saying is, it's amazing how little we have to go on, even at this late date, and that's getting super, super frustrating. That is all for today. As always, this show was produced by Ride Home Media. And once again, we do have a new Facebook page, facebook.com/coronavirus morning report. We're posting every episode there in case you want to discuss it with people. We're also posting some of the stories that we are considering for upcoming episodes. And we also invite you to share any stories that you've been seeing that you think might be a good fit for the show. So check it out, like and follow the page. Once again, it is facebook.com/coronavirus morning report. I'll talk to you again tomorrow. Be well.